So when it comes to COVID, COVID long haul, and the vaccine, this cascade of inflammation continues to happen. And in the long haulers is because of the non-classical monocytes with the endothelial cell lining continuously making the spike protein, etc. And same thing happens in people who get the vaccine. It keeps on. So the long haulers is because your body endothelial cells are affected, and you keep on having the spike protein, which becomes a sort of a target for your immune cells, and it keeps on creating more and more and more blood clots. And then with the vaccine, all of your cells, including the endothelial cells, keep on creating the spike protein, and this cascade of inflammation, inflammasomes, and cytokines continues to happen. And so that is why, if you look at it as a functional medicine perspective, which is one of my credentials, is functional medicine and Ayurvedic medicine, the holistic approach is how do you support your immune system to be able to reduce the cytokines to avoid the fibrotic changes, the blood clot formation, but keep it still active enough to neutralize these processes of inflammatory cytokines, etc. So whenever we look at treatment, you have to always look at the highest benefit derived from the treatment from the lowest, with the lowest risk possible. This is the essence of medicine. How do you choose a treatment that does not cause a high risk but produces or delivers the highest benefit? So when we look at some of these herbs and supplements, we're looking at this green box, highly effective and beneficial with the lowest possible risk. Whereas when you look at something like a vaccine, it is very low benefit with the highest risk possible. And also, do not do harm. It's the oath of any medical practitioner that we take. And if you knowingly introduce a high risk with low benefit to your patients, then you are nullifying that oath of do not do harm, do no harm. And so what we want to do with the treatments is to prevent the infection by enhancing the immune system to avoid this ACE2 receptor site and the spike protein to join and make that lock and key mechanism. You want to stop the replication by neutralizing the proteases, enzymes, etc., that make the spike protein and the viral replica. And you want to reduce the cytokines and inhibit some of these inflammatory processes and hasten recovery.